Hi, my name's Heidi Conley. I'm a cardiologist at Mayo Clinic, and today we're going to talk about bicuspid aortic valve and how that can affect a person. But before we do that, let's talk about how the normal heart works. The normal heart has 4 chambers and 4 valves. The top chambers are called atria, right atrium on the right, left atrium on the left. The bottom chambers are called ventricles, right ventricle on the right, left ventricle on the left. The blue blood or venous blood or deoxygenated blood coming back from the body enters the 2 big veins and drains into the top chamber on the right called the right atrium. It then flows through a valve into the bottom chamber called the right ventricle. As that chamber fills, it gets the message to pump, and blood is pumped out to the lungs. In the lungs, the blue blood is oxygenated, and then the oxygenated or red blood returns to the left side of the heart, and in the same manner enters the top chamber on the left, called the left atrium, goes through a valve into the bottom chamber, called the left ventricle, and as that chamber fills, it gets the message to pump, and blood is then pumped to the body. Under normal circumstances, there's no connection between the left and right heart chambers after birth. The aortic valve is not pictured here. It's the valve that separates the left ventricle from the body. And so as we look at it in this schematic, we can see here left atrium or top chamber, left ventricle or bottom chamber, and aorta. The normal aortic valve has 3 cusps. In persons with bicuspid aortic valve, that valve is abnormal and has only 2 cusps. So a couple of things about bicuspid aortic valves. They're very common. They affect about 1% of the population, twice as common in males as in females, and they can be inherited. And how is the bicuspid aortic valve found? It can be an abnormal finding on physical exam, where your provider hears a murmur or click, abnormal cardiac testing such as an echocardiogram or chest x-ray or CT scan. Some persons with an enlarged aorta are then subsequently found to have bicuspid aortic valves. A family history or genetics may lead to evaluation for a bicuspid aortic valve. And when valve or aortic disease occurs because of this, sometimes symptoms can develop. So let's talk now about disorders that are associated with bicuspid aortic valve. The aortic valve function may be abnormal, and in this situation, there can be narrowing of the aortic, so-called aortic stenosis, much more common than leakage of the aortic valve or aortic valve regurgitation. Also very common is the finding of an enlarged aorta or aneurysm, and less commonly narrowing of the aorta or coarctation. Infection can also affect the bicuspid aortic valve. There are certain disorders that tend to run in families, and bicuspid valve is one of them. In addition, persons with Turner syndrome are more likely to have bicuspid aortic valves than other individuals in the general population. And finally, other congenital heart defects can coexist with bicuspid aortic valve, and so we need to be on the lookout for them. How are individuals with bicuspid aortic valve managed? Well, the majority of patients can just be observed, but do require specialized care to look for the many different things that can coexist in individuals with bicuspid valve. Valve or aortic surgery may be required in the future, and sometimes both of these operations are required at the same time. And finally, screening of family members is very important, as is a healthy lifestyle, important for us all.